Hi, I'm Dr. Lynn Koswicz. I'm a primary care internist and the director of the Clinical Skills Assessment Program. Here we train lay people to be patient instructors, or PIs, where they will help you learn your clinical skills and help us assess your development as you progress through medical school. And before we begin, I'd like you to meet Linda Rubin, who's the patient instructor to help me make this video.
Hi, I'm Linda Rubin. I'm going to be the patient instructor that's going to be working with Dr. Koswicz today to review and teach you the core physical. What I want to talk to you a little bit is the role of the patient instructor. The patient instructor, there's two parts. There's the patient and there's the instructor piece. The patient, we learn to portray cases that your faculty have put together that they think is important for you to learn. And then the instructor piece is that we also provide you feedback and we coach you a bit about what we think is important, what we think you did well, what maybe you could improve upon. Again, welcome to Clinical Skills. We hope you find this time rewarding.
Okay, so what's the role of the physical exam in our patient encounters? Well, first and foremost, establishing a caring relationship. Paying attention to the patient's comfort and showing them respect as you move through the physical exam is very important in developing rapport with your patient. And otherwise, making a diagnosis, of course, is important. And you'll hear throughout your medical training that about 80% of diagnoses are made by history. And I think in my experience that's true. But the physical exam is very important to help you rule in or rule out other diagnoses that you're considering in your differential diagnosis. Also, the physical is important to establish a baseline in your patient, monitoring for complications of a chronic illness like diabetes, which might affect the nerves in the feet or might affect the eyes, and so you'll monitor for those kinds of things. And of course, just practicing the physical exam is very important in developing your skill at performing the maneuvers and in maintaining competency in performing the physical exam maneuvers. And so I would encourage you, you'll have many opportunities to practice your physical on peers, but also on patients and families, and on patients. You have many opportunities to practice at your click site and at the medical home, at South Park and Migrant Farms, and wherever you have the chance to see patients. I encourage you to practice your physical exam skills. And before we begin, I just would ask you to pull out the checklist that's on Blackboard. Physical exam checklist, the core physical exam. That's the checklist that the PIs will be using to help you learn and assess your skills on the core physical exam. But there are many other items that we're going to be asking you to do during your encounter with the patient that aren't on this checklist. And those are the things that you will be observing, but the PI won't be able to tell whether you're doing them. So for instance, you'll be observing whether the patient is in acute distress. How urgent is this encounter? And how quickly do you need to move through things? And how well do they speak or convey their story? How well do they move getting up and down on the exam table? All those things are things you'll observe, and they won't be assessing you on. Another one is the respiratory rate. If you tell a patient you're measuring their respiratory rate, the respirations will usually vary when people when they become conscious of them. And therefore, we usually do those when we're doing the pulse and the patient is not aware that we're taking the respiratory rate. So there'll be items like that, and I want you to watch for those as we move through the things that you will observe that won't be on the checklist. Okay. Now we're ready to begin to conduct the items on this checklist. And I have it in front of you, and take notes as we go along through the core physical. These are what we have on here, and what we're going to teach you is just one correct way. It's not the only correct way to do these items. These are a correct way that your faculty has chosen to teach and assess you by. But you will learn many other good, correct ways and to build your repertoire of maneuvers as you go along through your education. But I just want to emphasize, when you're in clinical skills, you'll be expected to demonstrate proficiency in the way that we're going to teach you today. So let's begin the core physical exam.
Welcome to a walkthrough of the core physical exam. To start, enter the room, introduce yourself, and ask the patient how he or she would like to be addressed.
Hi, Ms. Rubin.
Yes.
I'm Dr. Koswicz.
Hi.
I'll be doing your core exam today.
Okay.
How would you like to be addressed?
You can call me Linda.
Okay, Linda. I'm just going to wash my hands.
Okay.
Wash your hands using either a sink or the alcohol foam dispenser, depending on what's in the room. Next, grab an alcohol pad and clean the tip of your stethoscope.
All right. I'm going to check your blood pressure. I'm going to ask you to get up on here.
Make sure you pull out the footing for the patient to step up.
I'll cover you with this right there.
Thank you.
Just going to check the skin on your arms before I put the cuff on. Good.
Start by wrapping the blood pressure cuff around the patient's arm, making sure the length is within range. Next, palpate the radial pulse, which is on the thumb side of the wrist. With your other hand, pump up the cuff until the pulse disappears. Now quickly deflate the cuff.
Okay.
Use your stethoscope to listen to the brachial pulse, making sure to support the patient's arm at heart level. Pump up to about 20 or 30 millimeters of mercury higher than where the radial pulse disappeared, and then slowly release the pressure. The first sounds you hear are the systolic blood pressure, and the last sounds are the diastolic blood pressure.
– 122/66, so very good.
Okay. Good.
Now check your pulse.
Again, we are palpating the same radial pulse as in the blood pressure, and counting the amount of beats in 15 seconds. You will multiply the number by 4 to get beats per minute. When you have finished taking the pulse, do not tell your patient that you are moving on to breathing, as this will change their rate. Instead, keep your hand on the wrist and observe the rise and fall of their chest for the next 15 seconds.
Okay, good. Now I'm going to examine your eyes. I'm going to ask you to take off your glasses and look straight at me. I'm just going to pull down your lids and ask you to look up. Okay, and you look, if you could look up. Good. Okay, I'm now just going to check your field of vision and ask you to look straight at me and just point to the fingers when you see them moving.
Make sure your hands are halfway between yourself and the patient. You can start by flashing your fingers on one side and then both sides.
Good. Okay. Now I'm going to ask you to look straight at my finger, keep your head straight, and just follow with your eyes.
Here you want your fingers to move in a general H shape.
Good.
And you're looking for nice, smooth eye movements in all field directions. Kind of like this.
Okay, I'm just going to check your pupils. If you can look straight at me, I'm going to flash a light in your eye.
You will check for pupil constriction twice for each eye. First with direct light, and then with light on the opposite eye.
Okay, next I'm going to inspect your mouth. I'm going to ask you just to show me your bottom teeth. That's it. And lift your upper lip for me. Good. Now I'm going to look inside your mouth. Open your mouth for me and say ah.
Ah.
And curl your tongue up. Good. Okay.
Now we're going to test the sensation of the face. The 3 areas of facial sensation are seen here. Make sure you test once in each area.
If you can close your eyes and tell me when you feel me touching them.
Now.
Feel the same on both sides?
Yes. Now.
Same?
Yes. Now.
Same?
Yes.
Okay, if you can, now you can open your eyes. I'm asking you to raise your eyebrows up and close your eyes real tight. Okay, show me a smile and a frown. Okay, and now I'm going to ask you to stick your tongue out and we'll go back and forth. Okay, and now I'm going to ask you to turn your head against the mic. and in this way. Good. Okay, next I'm just going to check your neck for swollen glands. Is it okay if I undo your gown?
Sure.
For feeling the lymph nodes, start by identifying the sternocleidomastoid muscle, seen here. To the front and back of it are the anterior and posterior cervical lymph nodes, respectively. Next, identify the clavicle, which is the bone seen here. Right above it, towards the outside, are the supraclavicular lymph nodes. Feel these using the tips of your first 3 fingers. The thyroid gland is directly underneath the thyroid cartilage, which is the Adam's apple. When the patient swallows, the thyroid gland will elevate up and then come back down. This will help you differentiate the thyroid gland from the mass around it, so you can know if it's a normal size or not.
Okay, so next I'm going to examine your thyroid. I'm going to ask you to hold this water.
Okay.
I'm just going to feel your neck here while I feel the thyroid gland. Okay, now I'm going to ask you to take a sip of water and hold it. And swallow. Good. That feels normal. I'm just going to check the skin on your back. Have you noticed any changes there?
No.
Okay. And now I'm going to listen to your lungs. I'm going to ask you to take a deep breath through an open mouth. In and out. Good.
These are the 3 spots, one on each side, for the lung fields that we'll be listening to. Make sure you check side to side for symmetry before moving down.
Okay, now I'm just going to tap on your back.
Here, most of the pressure is being applied by the hand on the skin. The second hand comes in to give it a light tap. Again, we're using the exact same 6 spots here.
Now I'm going to listen to the front of your chest, so I'm going to ask you to lower your gown and just hold it there for me. Deep breath through an open mouth. Good. Next I'm going to ask you to lay back. I'll just cover you with this sheet. You could just turn your head a little bit to the side.
Here, you're observing any visible pulses from the internal jugular vein. As a landmark, this runs under the sternocleidomastoid muscle, seen here.
Okay. And go ahead and look straight up. I'm just going to check the pulse. Okay, good. Can you raise your gown up for me? I'm going to examine your heart just below your breast. Okay. I'm just going to feel the heartbeat. Okay, good. Now if you could just lower the gown. I'm listening to the heart. You breathe normally.
So here's a super simplified anatomy of the heart. When listening to the heart, we are interested in the blood flow from the 4 valves. Blood comes in the right atrium and goes through the tricuspid valve to the right ventricle, and then it goes through the pulmonic valve to the pulmonary trunk. It comes back to the left atrium and goes through the mitral valve to get to the left ventricle. Finally, it goes through the aortic valve and leaves to the aorta. So where do we listen to the blood flow from these valves? We're going to use our ribs as a landmark. Let's start with the second rib. Right under is an area called the second intercostal space. Just right of the sternum, in that space, is where you listen to the blood flow from the aortic valve. Just left of the sternum, in that same space, is where you can listen to the blood flow from the pulmonic valve. Staying left of the sternum and moving down to the fifth intercostal space is where we can listen to the blood flow from the tricuspid valve. Moving laterally to about here is where you can listen to the blood flow from the mitral valve. So in practice, it looks something like this.
And listen here. Now I'm going to listen with the other side of my stethoscope.
Make sure you let the patient know that you are switching sides to the stethoscope. When using a tuning stethoscope, mention that you will now listen lightly.
Okay, I'm just going to ask you to sit up while I lower the bed. Okay, you go ahead and lay down. Now I'm going to check your belly. I'm going to ask you to just move the drape on down.
Sure.
Okay. And I'm just looking for any scars or moles. And now I'm just going to listen to your belly for a minute. Okay. And now I'm going to press, and I want you to tell me if it causes you any discomfort here, any pain.
No
Okay.
pain.
Okay.
Okay.
Okay. All right. Next, I'm going to check your liver. I'm going to ask you to take a deep breath in and blow it out. Let it out, and take a deep breath in. Okay. Good. We're done there. I'm just going to push on your leg and check for any swelling.
There are two pulses we can feel in the foot. The first is the posterior tibial, which runs right behind the ankle on the medial side of the foot. The second is the dorsalis pedis, which runs on the top of the foot towards the medial side. You will palpate bilaterally like this.
Okay, now I'm going to take a look at your leg. That's okay, I'm just going to move this straight.
Sure.
Okay. I'm going to look at the skin here. And this one too? Okay.
Mm-hmm.
Okay. Everything looks good here. I'm going to ask you to sit up. I'm just going to change joints. Can I move this way?
Sure.
Okay. Now I'm just going to ask you to open your hands and close them. And move your wrists up and down. And now bend at the elbows. And raise your arms up overhead. Good. Now hold your arms out. Don't let me push them down. Good. And now hold your elbows like this and don't let me pull your arms out. Good. Now hold your wrist up. Don't let me push it down. Same thing. Good. All right. I'm now going to do the same thing in the legs. Can I move this straight?
Sure.
Okay. I'm just going to look at the hips. All right. And I'm asking you to lift your hip and put it down. Now lift this side, put it down. And straighten your knees on both sides. And bend at your ankle. Good. Now I'm going to ask you to lift this thigh. Don't let me push it down. And now lift this one. Don't let me push it down. Good. And now straighten your knees. Don't let me push them back. And point your toes up and don't let me push your feet down. Good. Next, I'm going to just check out your sensation. I'm going to ask you to close your eyes. And just let me know, does this feel the same?
It does, yes.
Here?
Yes.
And here?
Yes.
And here?
Yes.
Okay. Good. Next, I'm going to check your reflexes.
Place your thumb or finger into the crease of their elbow. With each hit of the reflex hammer, you should feel a tendon flexing into your finger.
Same thing on this side. And now your knees.
For the knees, feel for the actual kneecap and hit in the space directly underneath it. Make sure you're on the patient's side to
Okay,
prevent
good.
getting kicked.
Now I'm going to ask you to step down. I'm going to watch you walk. I'm going to ask you to walk over to the door. Good, and come on back. Good. Okay, excellent. So that's the end of our exam. I'm gonna step out. I'll ask you to get dressed, and then I'll be back in, and we'll finish the appointment. Okay?
Okay, great.
Any concerns or other things
Nope.
you feel? Okay, I'll be right back.
Okay.